My name is Michael Holmo. I'm an orthopedic sports medicine physician here with Avera and Brookings Health System. My personal experience with sports injuries started out when I was very, very young. In 5th grade, I was injured playing flag football in a backyard, stepped in a gopher hole, and I injured my knee. From there, I had some pretty amazing care at one of the local hospitals. Following that, when I was in high school, playing football again, tore out my rotator cuff on my shoulder. I had an arthroscopic procedure to repair my rotator cuff, and that was kind of the birth of how I got into orthopedics and sports medicine. Sports medicine is a branch of orthopedics that deals with injuries to ligaments, tendons, bones, and all the connective tissues surrounding them. Whether it's an ACL or a rotator cuff tear, orthopedic sports medicine is designed to care for an athlete. Athletes often have an injury pertaining to their sport, whether it's a soccer player, a younger female who has an injury to their ACL, or a football player who has an injury to their shoulder, such as a rotator cuff tear. It affects their daily function. When you have a kid and you have an injury, you know that it's holding them back from what they want to be doing, and they can't really progress until they're feeling better. So as a sports medicine orthopedic surgeon, we're here to provide that care for them. It's basically changed in the treatment of, kids are becoming much more competitive at a younger age, whether it's gymnastics, tumbling, basketball leagues where they're 3 or 4 getting very, very active early on. Kids you see with early on injuries, specifically to the ACL or the shoulder. Sometimes you see injuries to gymnastics with hips. Hip arthroscopy has been a new birth of orthopedics, which has just recently started out, and it's a treatment that has helped a lot of people get back to where they want to be in sports. Sports injuries are diagnosed first and foremost by the patient coming in, giving us a history of what's going on, when did it start, and how has it progressed. Once we have an idea of what's going on, we are able to do a physical diagnosis and physical exam on them. And if we do require an additional test, such as an X-ray, ultrasound, CT, or MRI, to get a better idea of what's going on, we do order that. An athlete or a parent should, definitely bring their child in for evaluation when they're having continued pain, whether that's in any area of their throwing shoulder or elbow or wrist, or if they've had a fall and they need to get a second idea of what's going on. I would say come in and be evaluated. Athletes can have a wide variety of treatments, whether that's an injection of a steroid or a platelet-rich plasma. Some of the newer techniques that we're using nowadays in orthopedics, we can offer all of those here in Brookings. My goal personally is to get them back on the playing field or back to the condition that they were in previously. I want them without pain. I want them to be as active or more active than where they were before their injury. I'd recommend Brookings Health for sports injuries because we are embedded in the community. We take care of our athletes, whether very, very young or high school or up to the college. We're here for anyone